Welcome back to the Physio Foundations podcast, where we talk about the knowledge and skills that provide the foundation of expert clinical practice. So it's my pleasure this week to bring on somebody who's not a physio, but who you're going to be very interested to hear from, and that's Ben Meadley. So Ben is a flight paramedic, and he is an academic here with me at Monash University. And I've been lucky enough to be on his supervisory team, so supervisor for his PhD over the last few years, and that's how I met Ben. And if I'm bringing him on here, this is a sure sign that this is going to be an interesting conversation. I always love talking to Ben. Always something interesting comes up. And we're also going to find out from Ben what his thoughts are looking at us, looking at the physiotherapy profession as someone with a lot of experience going to physio himself, but also working in a related field. So Ben, welcome to Physio Foundations.
Thanks for having me, Luke. Pleasure to be here.
So let's go through the bio, rather than me reading a big, long bio of you, because you've got plenty of things you've done. Do you want to tell everyone just a little bit about you and your background and what you do?
Yeah, sure. So I completed an undergraduate in exercise physiology / human movement, and ironically had looked to physio as a potential career option during those stages. I eventually became a paramedic for a range of reasons, mostly those sense of purpose and vocational interest in the field, and it aligned with a lot of that academic vigor, aligned with working outdoors and all of those things. So I've been a paramedic now for about 25 years. I've always maintained a keen interest in human performance in various forms as I've gone through. And the vast majority of my career has been as an intensive care paramedic. And in Victoria, we call those types of paramedics MICA paramedics, mobile intensive care ambulance. I've worked in a couple of ambulance services around Australia, but the most amount of that time has been back here in Victoria. And for the last 14 years, I've been as a intensive care flight paramedic with our helicopter rescue service, where we do a mix of search and rescue work, complex clinical work, roadside traffic accidents, intensive care transfers from regional facilities of sick people who need to be in major hospitals. So that's my career. And then I've always continued to have an interest in research along the way. And I've been fortunate to have a clinical research background, as well as some of the more human performance orientated research that made up my PhD.
And we'll get into that because that's really relevant to a lot of professionals, and that the angle that you took to look at the health of paramedics in your PhD. Kellyanne Bowles, Associate Professor Kellyanne Bowles, was on the podcast a couple of episodes ago, and she described you as one of the most humble people that you ever meet. So you're not exactly going to be blowing your own whistle about all the things you've done, but I think she also described you as someone that you'd really like next to you if you have an accident or a heart attack or something along those lines as well.
So hope that was the case if there was any paramedic. But it's one of those funny lines out of being a paramedic is that you never want to do any work, but if the work's going to happen, you want to be there to provide the care.
Right. And so 25 years of experience, and then you mentioned an exercise physiology background, and there was elements of physiological measurement in your PhD.
Yep. Yeah.
And then it's interesting that I remember we were talking about that originally. You were thinking about being a physiotherapist. You'd have some real insights into, as a patient, as with your family, involved with physios, and then working as a researcher alongside physios, myself included.
Yeah, absolutely.
I'm going to ask you soon about your perspectives on what makes a really good physiotherapist, because I think that's an important thing for someone from the outside to look in and reflect on. So, but before we go there, let's talk a bit about what you did, your specialty area, and what you did in your PhD. So look, your PhD, as people are about to find out, broadly was related to the health of paramedics.
Yeah.
And I want to ask you why, first, we'll start broadly. Why is it important that all health professionals care about their own health, beyond just saying it's important?
Yeah.
Why is that so important?
Yeah, it's a great line. And look, although a large percentage of my work was focused on the pointier end of the career, so the specialised staff, where there is a large physical component to the role, the work was across all parts of the sector, right from graduate paramedics in their first year, in a similar fashion to a physio. You do your immediate post-graduation phase of clinical practice, where you go on to become a registered healthcare professional with APRA. So in that phase, I think, which was one component we looked at, that can be the most challenging part from a well-being point of view and a health point of view. You're young, you might be living out of home for the first time, you've got a salary, and you can, if you want to buy a pack of M&Ms, you don't have to stop and think about it, so you can. You also largely in both physio and a lot of other healthcare professions, including paramedics, have large sedentary periods or stationary periods, followed by periods of physical activity, and sometimes extreme physical activity, certainly with our paramedics performing manual handling tasks, a huge area of interest for your audience, and the potential injuries that go with that, along with things like prolonged CPR, crouching positions, confined spaces. There's a lot of things that factor into it, but a lot of it is the lifestyle stuff as well. So for the first time you work shift work for a period can be really challenging, and that's one of those things that is a unavoidable reality of paramedics' lives. And the circadian disruption has a range of consequences, personally, professionally, sleep, your metabolism, the food choices you make, your social interactions. There's so many layers to being a well person. And although we weren't able to cover all of them, as any person in academia finds out, you start with a very big idea and you hone it down. We thought it was important if we think of one thing that's really important, it's the individual. It's secondarily the translation to patient outcomes, which we didn't answer, but a reasonable hypothesis is that a more well clinician provides better care, which is universal to all healthcare. And then I guess we want a sustainable workforce as well. We don't want people leaving because they're unwell and that the job makes them unwell. So we looked at a lot of those things, and then the other end, we've got a group of outliers, so the specialised staff who tend to, if we were to say there was a trend to some poor health behaviours early in the career, we've got people who've been in the job for decades who show very good health literacy, but good health profile as well. So there's a lot of components to it, but I think the big ones are longevity and the ability to maintain your own well-being, health and well-being, so you can provide good care.
And that's what it comes down to, because you need to be in the profession for long enough to learn the skills. I mean, one of the themes that's come out of the many conversations I've had on this podcast is that, work hard, get yourself to the starting line for your career as a student, but then acknowledge that it takes time and it's many, many years of experience to become that professional that can really help people with challenging problems.
Very true.
Let's talk about a little case study that everyone can relate to and probably knows about, of when we can thinking about what the acceptable baselines of physical fitness and health are. Yeah. And this is our good friend Johnny Utah from the film Point Break. Ben once in a university presentation started off his presentation with some video that he'd screen grabbed of Johnny Utah running along in that scene when he's chasing Bodie and they go down into the drain and Johnny Utah does his knee. Do you want to tell us, that was funny, but then it was really relevant. It really tied into the story of your PhD. Do you want to tell everyone why you showed that video?
So hopefully everyone's had the chance to see the original and the best version of Point Break, and which is what Luke's referencing. And in fact, I showed it to my kids over the school holidays to make sure that they're culturally appropriated into good 90s movies. So, and in this scene, there's an undercover FBI agent who ironically has ended up working for the FBI because he suffered a knee injury in his college football career. And that's a known entity. They know he's got some kind of physical compromise. But then he goes out into the field and he's chasing one of the bad guys, our friend Bodie or Patrick Swayze, the actor, dearly departed, and he chases him and he falls off a ditch, as you said, into a drain, and re-hurts his pre-existing injury and can't chase down the bad guy. And for me, that sums up the concept of physical employment standards. Should be able to identify a person's capability to do a job. And if the robust physical employment standards were applied to that individual, Johnny Utah, he would have been eliminated from being able to do the job, because one of his job-related tasks is to chase bad guys, jump down off fences and ditches without injuring yourself or without exposing pre-existing injuries. So, we were able to, in fact, I did now that my PhD's finished, I presented it to a group of rescue swimmers, and they all got it straight away. As soon as they were able to see Johnny Utah and Point Break context, they understood the science. So it was quite good.
So good. I was trying so hard not to laugh there. Not at you, but with you. Just, I've never heard a summary of, that's the greatest summary of the film Point Break I've ever heard. It's really, how can we apply that to other professions? So not every profession needs to jump down ditches and chase bad guys.
Yeah, that's right.
So what if we try to think across laterally and think we'll think about physiotherapy. There's a Physio Foundations podcast for our audience. So what, and this is a pretty broad question. We could go anywhere with this, but what do you think people should consider as their sort of acceptable baseline of physical fitness? It really depends what you're doing, doesn't it?
That's right. So one of the parts of the scientific methodology of developing a physical employment standard, or at least something that guides the types of criteria for your job, is a job task analysis. And so I think that physiotherapists as a profession have a really important role in that concept. There's very few people who have that functional anatomical understanding, and as all the listeners will completely understand, that advanced anatomical, physiological, and functional component of your physiotherapy education is what gives you that unique understanding of human movement, comprised with the fundamental understanding of gross anatomy, coupled with the functional part of the anatomy, the kinesiology, if you like, of that, and then the understanding of lever systems, the more complex biomechanical aspects of human movement, and identifying if somebody is to perform a task, then what are the anatomical and physiological and kinesiological implications of movement within a task. So physiotherapists actually are the SMEs in this area, in my mind, because there's no other health or craft group.
Sorry, what was SME?
Oh, subject matter experts. Sorry.
Gotcha.
So there's no other real kind of group that holds all of that intellectual property, if you like, around these types of areas. So biomechanists by design are generally scientists or high performance sport technicians with strong academic component. Exercise physiologists have a different appreciation at the other end of the spectrum, but in the middle, I think physio are the people. They're the Swiss Army knife of human movement. They've got every single option, and so for the micro in that question, which is what does a physiotherapist need to do in regards to preparing themselves from a physiological and physical performance point of view, well, the job task analysis applied to that role is probably standing in one spot for extended period of times in awkward position, twisting, moving, and then performing manual laborious tasks whilst in an awkward position. And no doubt you spend quite a bit of time making sure that you optimize that. Periods of sitting, completing your pre or post analysis from a patient, and then having to demonstrate exercises yourself. And that's the big one for me, which I can kind of hark back to my time as a gym instructor. And it doesn't become obvious on the camera, but I'm 69 kilos dripping wet. And, I've peaked at my gross weight after 25 years plus of trying to put, muscle weight on unsuccessfully. So as a gym instructor in the late 90s and early 2000s, I was probably 62, 63 maybe slightly more kilos and 6 foot on the dot. So I've got to go and demonstrate a bench press or a squat or whatever. I had to make sure I had the capacity to be able to demonstrate those exercises. Maybe not with a couple of 20 kilo plates on the bar, but for me, in that environment, I had to be able to practice what I could preach. And so for physiotherapists, obviously, it's one of those things where you have the absolute necessity to be able to have to demonstrate the task. And I'll tell you this great physiotherapy memory I have, if you like. There was a clinic, Paran Sports Medicine, when I was a junior cyclist, and I used to go there for just some prehab for leg strength. I had a bit of a 1 week knee, and so I remember Lynn, can't remember her surname, but the physio there said that
Lynn Watson.
It could very well have been.
Yeah.
But she had said to me, your VMO is inactive and your lateral knee strength is poor. And she stood there in her high heels, put 1 foot behind her glute, and just stood there with perfect posture on one leg in high heels, and goes, if I can do it in my heels, you can do it with flat feet, as a 16, 17-year-old or whatever it was. So, to round that out, she could demonstrate the exercise. She had the capacity. She had the preparation. She had the holistic approach to her own health and well-being that meant that she could do her job. She could demonstrate a range of exercises. So that's, I guess, the micro answer. From the wider health system point of view and the role of physiotherapists in helping people understand what they do for a job. We would love it if organisations and employers had an overarching policy to make sure that they mandated minimum requirements for a job and had completed a scientifically validated job task analysis and physical employment standard. That's often not the case. They are often quite arbitrary. But in our profession, for example, these manual handling tasks, awkward movements, confined spaces, prolonged sitting with periods of high intensity physical activity, that's right in the sweet spot of a physiotherapist to be able to identify those tasks, the movement patterns, and provide the patient, hopefully proactively, with the way forward to making sure that person's capable of doing their job.
And so with your profession, there's some non-negotiables and there's lives at stake.
That's right.
As well. And then there's a bit of a balance as you go further back along the high performance end to perhaps where we are with our work, where it's an inclusive profession as well, and we don't want to be ableist, and that we should be including many different types of people and finding ways that they can work as well. But I thought that was a really, really nice answer to a very poorly worded question from me. You really dug out the essence of that somehow. You must know me.
Oh, it's like we've met before.
That's right. And great physiotherapy memories. That maybe I need to make that a segment on the podcast as well. It's got a low threshold for a great physiotherapy memory, but that's that example of being able to demonstrate exercises. I really want to emphasize that for our students and grads, because if you're using exercise as a primary part of your interventions and your strategy, you need to be able to play the part and demonstrate them really well. So that takes you. And Chris Seville, who was on the physio, was on the podcast a few episodes ago, who really focuses on strength training in his clinic, really made that point as well. You do need to walk the walk.
Yeah, that's right. And I mean, look, it's one of those things. I'm trying to find a reasonable example, but the faith that you then exert to your patients. It's like if I had somebody who's in a critically unwell situation, the reassurance I'm able to give them is often verbal. You express a degree of professionalism by whatever it might be. So, providing that person with responses to their queries about their current, health status, reassuring them that we're there to help them and that we're able to provide the care that we say we're going to provide, performing tasks for example, let's say putting an IV in or applying some ECG dots or whatever, but doing them confidently and capably. I would liken that in physiotherapy as just one of the many, many things that physiotherapists do. Is, demonstration of exercise would be something that asserts faith back to the patient that they're being well looked after.
Mm. What else do you think are fundamental knowledge and skills for a physio? This is from someone who has worked with many physios and has been to physios. And so you've mentioned the ability to play that part and demonstrate exercises, for example. Yep. What else do you see as a really important professional skill or an attribute that makes you want to trust them and work with them for your rehabilitation as a patient, perhaps?
Look, I think one of the evolutions of healthcare professionals across the board is that emotional intelligence almost, and the ability to listen, recognize when listening is the most important part of the conversation, but also listen have that capacity to understand when it's time for you to then say to the patient, well, this is what I'm going to do for you. But also, of course, physiotherapy is the perfect space, a little bit difficult in my area, to allow the patient to dictate their healthcare plan. Whereas, again, another great physio memory of very recent times, I've got a, ongoing bit of sacroiliitis that's just been, a lifelong thing that I've just had to manage, and it can really flare up, especially flying around in the helicopter in a cramped environment. And I'm a cyclist by choice, which means and the physios would all completely understand this, I'm a one-trick pony, basically. I can go one direction. I've got no lateral stability. I'm great in a single plane of movement, not too good in multiple planes of movement, which is something I've really tried to work on, especially as I get older. And I'd said to my physio locally here, and I live in a very small town, and we've got this amazing, it's a disproportionate amount of expertise in this small town, and these fantastic groups of physios, and one guy in particular that I see. And I had said to him, my care plan for me is I'm 46 and I want to feel 35 as long as I can feel 35. That's all I asked of him. And he then designed my clinical Pilates, my home-based movements, and then my attendance at clinic based completely around that assertion. Because that's all I want. And I'm not stupid enough to think I can feel 21, because those days are never coming back. But I don't want to feel – sorry?
Yeah, 35 felt better than 21 for me. But
quite probably anyway.
Let's go 35.
That's right. But look, I attribute him taking that request or my contribution to my health plan and him translating that to reality, to me feeling probably I at 46, I feel as well as I ever have. And, there's a lot of components to that, but I go to clinical Pilates with him every week and I wouldn't miss it. And even though I'm not injured at the moment, I know I stay that way largely because of his care. And he really just did listen to what I wanted. And so I rambled on about all of the things that I've just rambled on about. And he was able to, take that and craft the program. And then if I didn't like a movement or an exercise, he was happy to adjust and be flexible. So I think empathy, emotional intelligence, flexibility, and allowing the patient to have a voice in their own care is a really great way to look at it. And we try and inject a lot of those as paramedics face-to-face. But, that it's not always possible sometimes.
It looks different, doesn't it, for when you have time and you're working with someone and you're spending 20 minutes figuring out the complex history and their goals and everything versus saving a life. And this has to be done, not negotiable.
Yeah, we just do it in a compressed format, basically.
That's really interesting to hear that.
Yeah.
But that's even in that time where life is critical, you're still approaching this from a patient advocacy and sort of patient-centered way, just in a compressed amount of time. Yeah. So if you can do it there, then we can do it when we have more time in a physiotherapy context.
It's interesting. I can see it from here, but I've got a book of we often get commendations from patients who go through the usual pathways of feeding back to the paramedics. And I've got over 25 years, a pretty reasonable book full of these, and not one of them is about a procedure that I did, or a drug that I gave, or anything technical per se. It's all about the humanistic stuff. They were made to feel safe. They were made to feel cared for. It wasn't necessary. And I've got one, interestingly, from a patient who'd moved to a country area. She was an ex-Supreme Court judge, and she'd retired to the country literally a couple of weeks later. And the first thing that she did, she thought she needs to clean up her yard. And so she decided to have a bonfire, and she threw a bucket of petrol on the bonfire, not knowing any better, and suffered some fairly severe burns. None that were life-threatening, but they're enough that we needed to put her to sleep to protect her airway, because she'd had some airway burns. And she was fine, had a great outcome. But it was in a very, very small country town hospital with no medical staff in, and we had to go in there on the helicopter and kind of take over this job. When I say take over, work with the team to achieve the outcome. But we were called for our expertise to go and resolve the problem. But she was awake and alert prior to us giving her the anaesthetic. And it was the decisiveness that was the feedback. And so people like that. People like being listened to, but somebody, people go to you and physios in particular to solve a problem for them. And so that's your job. And you've got the armamentarium to do it with the education that you get, especially at a place like Monash.
There's your emotional intelligence there, and experience as well, of knowing that it's on a continuum, that you need a bit of both. So listening to people and letting them guide, and being an advocate and being a part of their care, patient-centered care and patient advocacy. And then having a plan and saying, this is what I think I can offer you. Or in your case, when things are more time critical, this is what's happening, and more directing and letting them know what's happening. Yeah,
that's right. That's right. And again, if people feel they're part of the plan, and they own the plan themselves, well, then they feel empowered to enact it. And, compliance with physiotherapy would be one of the banes of your existence, no doubt. It's like, oh, okay, well, we're doing a follow-up. Have you been doing what we've requested you to do? No. And
although even that conversation is evolving away from even the words compliance towards something that's more team-focused, team-based. So
absolutely.
I'm wearing the white coat and I'm telling you what to do and you're not compliant. I think that's a language thing as much as anything.
Absolutely. Yeah.
And so one thing that the listeners who, if you haven't worked with or spoken to a lot of paramedics, you may not be aware about, is just the evolution of this profession from where it used to be to where it is now, really a professionally driven, research focused profession, which a lot of that has been driven by Monash, Department of Paramedicine, yourself, Kelly and Brett, and everyone, lots and lots of people I've had the pleasure of meeting over the years in that department next door to mine. And so it's very interprofessional, isn't it? It's not just a matter of you're there on the scene. And so you really work with a range of professionals. Yeah. Not just in your role in the exciting stuff of rappelling out of helicopters and things, but just across paramedics. What's your interprofessional work? How do you interact with other professionals?
Yeah, it's great.
And what have you learned from that?
Yeah, it's funny because, obviously very much part of a system, and no doubt with physio, there is that very same relationship. And I think one of the things that helps break people's barriers down, because when especially junior staff, when you start off, you go, well, I've just spent all of this time gaining all of this knowledge. I'm bursting at the seams with the ability to translate that into practice and reality. And at that part of your career, you feel like, well, I've been educated, taught, I've done clinical placement. Now's the time as I go out into the workforce to express my expertise. As time goes on, of course, you realize that you can't be all of the things. So you can't do all of the jobs, and it's just, especially in a complex world, in a complex healthcare environment, it's just not possible to be the single source of truth. So we have a range of different professionals that we work with, and that includes the nursing and medical staff within the hospital bounds. It includes the volunteer lifesaver on the beach where we might have gone to a case. It includes the volunteer firefighters, SES workers. It includes police officers. It includes mental health teams. There's such a huge range. The people in forest fire management, park rangers, the sheer amount of people we interact with on a daily basis is quite enormous. Ski patrol. And it's funny. I think one of the things you work out, especially when you start dealing with volunteers, and this might be particularly pertinent within sporting clubs or other types of organisations that use the services of physiotherapists, is you just never know who you're standing next to, and that you should always make an assumption that they're somewhere very close to you, within less than that 6 degrees of separation, is probably someone who knows more about what you're doing than you do. And I'll give you a number of examples of the Surf Lifesaving Club not far from here, where we'll often respond to cases. And the reason I know all of these things now is because my kids are part of the club. But the professor who's the head of the Murdoch Children's Research Institute into infectious diseases is one of the stalwarts of the club. I think there's something like 17 physicians who are parents of the nippers at the club. So we can go and land our helicopter on that beach and walk in, making an assumption that we've got this all under control, and that I'm here, I'm the only one who can solve the problem. Whereas there's probably 20 people standing within 5 meters of me at that particular beach on any given nippers day that can probably do everything that I can do and more. And so I think that the term I use is, if you think you're the smartest person in the room, well, then you've self-declared that you're not, by thinking that in the first place. Because I think, we often interact with these volunteers around the place, like SES, CFA, and a range of other groups, and they're often full of very, very capable people, which is it's often a pleasure when you find out these things and you're like, wow, great. That's a fan. Rather than saying, well, I'm going to protect my turf, I own this, I'm going to do this. You go, come on down, let's all work together to achieve the outcome. And so I think that that working in multidisciplinary teams and recognizing what each person can give has been, I think, a part of my journey that I'm proud of, is that I get these tiny little feedback loops living in a small town, where I'll hear on my Tuesday morning bike ride from the cousin of the SES captain that I did a pretty good job at that car accident the other day, and everyone felt like they were part of the team. Because I won't run into those SES people until the next job or whatever, at which point we don't have a chance to talk because we're up to your arms in doing something. So the Bush Telegraph is often where I hear this feedback that things have gone well by just simply respecting everyone else's role, but also leveraging everyone else's role in a multidisciplinary team, recognizing who's got the talent to affect an outcome, and working together to allow them to maximize their contribution to any given situation, whether that be in primary healthcare, whether that be in critical care, where I spend most of my time, or whether it be in academia for that matter. I think our project speaks to multidisciplinary teams very well. I don't have the musculoskeletal and overarching movement-based understanding that you do. I could never do that. I've got a history in it, but it's tiny. We had Dr. Joanne Caldwell from physiology. I did an undergraduate exercise physiology degree, but I'm not an expert in it. But Jo is, so let's go and ask her what she thinks about it. And we really sought out a great team of collaborators who brought all of their expertise into one place to achieve the outcome.
You can really apply what you're saying here to work as a physiotherapist. And I am trying to link this back to physiotherapy.
Yeah, of course.
I could go talk to you forever asking you follow-up questions about what it's actually like being on the side of those, in those high pressure situations. And perhaps we can do another episode and do just that. But say we're applying this to physiotherapy work, it's always multidisciplinary.
That's right.
And so what you said before was always assume that there's going to be at least someone in your immediate area that knows more than you and that you can draw on their expertise. So we can apply that to working in a hospital. It's quite obvious. People have name badges and you know who they are and defined roles, but even working out in the community and having even just the thought of, I don't have to know everything as well. It's quite comforting for a youngster. Now let's change that. Youngster. A young emerging health professional.
That's it.
Or a student. It's really hard to feel confident knowing how little you know. Sometimes you just continue opening doors and there's more doors behind there and you're always learning. Eventually you need to develop some confidence and then get good at something. And you don't know sometimes what would be the definition of a stupid question and what you're supposed to know. You don't want people to judge you. So a culture where we assume the best of each other, which doesn't always happen on social media and in those circles, but it certainly does happen in all the groups of professionals I'm lucky to be a member of. And just being aware that when you're a younger clinician or a student, that there's a lot of things you don't know, and that's okay. That's come up a lot in the conversations I've been having with people. But having the confidence to say, I'm not sure, even if you're supposed to know it, even if not be afraid of judgment. And you can always look things up. There's so many.
That's it. And I'm glad you brought that up because when I started my ambulance career, there was an assumption of rote learning the clinical practice guidelines. Right. And when you were, and this is a while ago, but you were expected to know them by heart. Now, they have evolved. I think the book might have been 100 pages when I was a junior paramedic. It's in excess of 500 now. So it's a very different kettle of fish. And so what that has translated for me is, so we've got an app with all of our guidelines now. And what I've actually done, even though I know a lot of my guidelines by rote still from just repetition over the years, I often make a point of being the most senior clinician and demonstrating, referencing hard copy material or whatever it might be in front of junior staff to normalize it for them, to say it's okay to stop, pause, plan, and ask the question, because I really do feel, even though that weight of expectation is often sometimes implied rather than actual, and you don't know if you don't know, then actually stopping and being safe in clinical practice is really important as well. And for us, the heat of the moment, compressed time frame means there's a bit more urgency to get some of those things done. But I had a case very, very recently where I looked up a medication dose in front of junior staff. I knew what the dose was, but I did it deliberately, showed their phone to all of us. Does everyone concur that this is the dose? We had the time to do this. They're like, yep, no worries. And hopefully they take away that message that it's okay to seek help, ask questions, cross check. And I know that everyone would go, well, we'd assume and hope that they do that. But, medical error is still overrepresented in the data with regards to poor patient outcomes across healthcare.
Look, pause, plan. So you've heard it from Ben. It is okay to pause and look things up. I think just empowering, particularly the younger clinician and the student, to say, well, that's a part of what you're doing. It's not only okay, but it's actually what you're supposed to be doing as well. And we're role modeling that. I'm thinking of the teaching. I've just come from teaching a really nice class of anatomy principles of joints and bones and muscles to the fresh first years this year, and had a really good session in there. And I said, I don't know 2 or 3 times during the session when I actually didn't know, and I looked up things with them, and it's that role modeling of learning through your lifetime. So
so I don't know is the ironically the phrase of the expert, because they're accepting their limitations.
That's such a good spot to end it on, because there's so much I don't know. And that's why I'm hosting this podcast, talking to people like you and learning so much. I hope everyone listening to this is enjoying these conversations. And Ben, we'll do it again.
Great.
So much
Thank
more.
you.
What we should do is talk about a little bit more about your research on the next one. But we sort of touched on it, touched broadly across things. But if you've got time for that, I know you're a busy man, but any final thoughts, anything else you wanted to add?
Oh, look, I mean, it's a privilege to be able to speak to this profession. You know, I've personally benefited and professionally benefited from my interactions with physiotherapy as a profession for many years. And I wish everyone all the best, and hopefully we can come back. We'll have another chat when they're a little further along. But also thanks for the opportunity. And I think as all healthcare professionals, you know, the evolution of all of our professions is about developing our emotional intelligence, empathy, of course, our capability with regards to what we do, but then aligning that with, you know, research and you know, pushing into new frontiers, as we like to say.
And just it all starts with you and your, as you said, your emotional intelligence and that attitude that you take into your work. That's so good, Ben. We're going to leave it there, and people can track you down by Googling you, Ben Meadley. They'll find your research profile. Anywhere else that you don't
Google Scholar, Orchid.
Look at your research papers.
There is a website. So there's benmeadley.com, which is just a homepage, a landing page for my research, and also just some of the resources I use in presentations.
Oh, we can see Johnny Utah in there doing his,
sounds good.
doing his run. So look, Ben, really appreciate your time and great to hear from you. So thanks very much for coming on. So for everyone still listening to this, we really appreciate you being a part of this reflective conversation. It's really important not only just to reflect and take time out to think about these deeper issues, but also to spread some positive messages about what we do. And you've heard from someone who's not a physio, who's worked closely with physios across his career, and he's given us a fairly positive summary of what we're doing. So, you know, have hope. Don't listen to everything that don't take everything personally that you read on social media in particular. And there's some amazing people out there that you can use as mentors and work with. So thanks very much for joining us again. So do all the things I always ask you to do: like, share, subscribe, connect with us at Periton Physio, or with me, if you like, at Luke Periton on Twitter mainly. And we'll leave it there. So thanks, Ben.
Thanks very much, Luke.
So till next time, this is Ben and Luke wishing you all the very best with your studying, professional development, and lifelong learning.